your body can actually develop an immune response against your Crohn's medication. And when that happens, the drug that was working stops working, sometimes within months. But the breakthrough research just presented at Digestive Disease Week in May 2026 might have found a way to prevent that from happening. Hi, I'm Kate, and today we're talking about antibody formation, the hidden reason biologics fail, and what the new combination therapy research means for keeping your treatment working longer. And this matters right now because if you're on a biologic or about to start one, understanding this could be the difference between years of stable remission and cycling through medications that stop working. When my son started biologics, his gastroenterologist mentioned something about checking drug levels and antibodies at his follow-up appointments. I nodded along, but honestly, I didn't fully understand what that meant. Then, about 8 months in, his symptoms started creeping back. His inflammation markers were rising, and when they ran the blood work, there it was. His body had formed antibodies against the medication. The drug that had been giving him his life back was now being treated like an invader by his own immune system. As a naturopath working with Crohn's patients, I see this pattern constantly. Someone finally finds a biologic that works, they get months or even a year of feeling good, and then it just stops. They're devastated. They feel like their body has betrayed them again, and often nobody explained that this was even possible. Here's what most people don't understand. Biologics are made from proteins that your immune system can recognize as foreign. Think about it this way. These medications, drugs like remicade, humira, stelara, they're incredibly sophisticated treatments. They're designed to block specific inflammatory pathways in your body, but they're also large protein molecules, and your immune system's job is to identify foreign proteins and mount a defense against them. So in some patients, the immune system does exactly what it's designed to do. It sees this foreign protein coming in every few weeks, and it creates antibodies against it. Those antibodies bind to the medication, neutralize it, and clear it from your system faster. The drug can't do the job anymore because your immune system is actively fighting it. Great, right? So this isn't a personal failure. It's not because you did something wrong. It's just immunology. And until recently, the main strategy was to either increase the dose, shorten the interval between doses, or switch to a different biologic and hope the same thing doesn't happen again. But the new research changes that conversation entirely. Let me break down what's actually happening with antibody formation, and then I'll explain what the new combination therapy research means for preventing it. So, we need to understand how antibodies form against biologics. When you receive a biologic medication, your immune system encounters this large protein molecule. In some patients, and this varies by drug and by person, immune cells called B cells recognize this protein as foreign and start producing antibodies against it. These are called anti-drug antibodies. If you're on remicade, they might show up on your blood work as antibodies to infliximab. If you're on humira, it'll be something different. Once these antibodies form, they bind to the medication in your bloodstream. This dose then becomes a bit inactive, and it also does two things. It neutralizes the drug so it can't reach your gut and do its anti-inflammatory work, and it speeds up how quickly your body clears the drug. Your drug levels drop, your inflammation comes back, and you're back to square one. This can happen within months, or it might take a year or more. Some people never develop antibodies at all, but when it does happen, it's one of the most common reasons biologics fail. So why are some patients more prone to antibody formation? There are patterns we see. Patients who have longer gaps between doses, like if they miss an infusion or injection, tend to have higher rates of antibody formation. Your immune system has more time to notice the drug and mount a response. Patients on monotherapy, meaning the biologic alone, without immunomodulator like humira, also tend to develop antibodies more often, and this is where the research gets interesting. For years, gastroenterologists have known that combining a biologic with immunomodulator reduced antibody formation, but immunomodulators come with their own risks. They suppress your entire immune system, increasing infection risk and requiring careful monitoring. So the question became, is there a way to prevent antibody formation without using a broad immunosuppressant? So what the new combination therapy research actually found, the study presented at Digestive Disease Week in May 2026, now, tested something different. Instead of combining a biologic with an immunomodulator, researchers used two biologics together, specifically targeting two different inflammatory pathways at the same time. And here's why this works. When you use two biologics that work through different mechanisms, you're essentially creating a broader immune suppression that's more targeted than something like humira. One drug blocks one pathway, the other blocks a different pathway, and together they reduce the immune system's ability to mount an antibody response against either drug. The results were striking. Patients on combination biologic therapy had significantly lower rates of anti-drug antibody formation compared to patients on monotherapy. Their drug levels stayed therapeutic longer, and their remission rates were higher at the 1-year mark. Now, this is still emerging research. These combination therapies aren't standard practice yet, and they're not appropriate for everyone. But what this tells us is that we're moving towards smarter strategies for keeping biologics working longer. So what does this mean if you're currently on a biologic? If you're on a biologic right now, here's what you need to know. First, ask your gastroenterologist about monitoring drug levels and antibodies. This is standard practice in good IBD care, but not every clinic does it routinely. You want to catch antibody formation early, before you lose all response to the medication. And second, if you're on a biologic alone and you're doing well, this might not be an issue for you. Some people stay on monotherapy for years without a problem. But if you've had biologics fail before, or if your drug levels are dropping, a combination approach might be worth discussing. Third, understand that if you do develop antibodies, it's not the end of the road. Sometimes switching to a different biologic in the same class works because the antibodies are drug-specific, not class-specific. Sometimes optimizing your dose or adding an immunomodulator can help. And now with combination biologic therapy being researched, there are more options on the horizon. So, fifth, the naturopathic support piece. From a naturopathic perspective, while we can't prevent antibody formation directly, we can support the overall environment that makes your biologic work better. Gut barrier health matters. If your intestinal permeability is high, you're exposing your immune system to more triggers, which can make it more reactive overall. Support gut lining integrity with things like L-glutamine, zinc, carcinogen, and omega-3s, creating a calmer immune environment. Stress management matters. Chronic stress activates immune pathways that can increase inflammation and potentially make your immune system more reactive to foreign proteins. This doesn't mean stress causes antibody formation, but it does mean that managing stress supports your overall treatment response. And nutrient status matters. Vitamin D, for example, plays a role in immune regulation. We know that patients with adequate vitamin D levels tend to respond better to biologics overall. Again, this isn't about preventing antibodies specifically, but about creating the best possible environment for your treatment to work. These are the things we layer in alongside medical treatment, not instead of it, but as support for it. So, let's come back to where we started. Your body can develop an immune response against your Crohn's medication, and when that happens, the drug stops working. But now we understand why this happens. It's immunology, not failure. We know how to monitor it with drug level testing, and we're seeing breakthrough research that gives us new strategies to prevent it from happening in the first place. If you're on a biologic and it's working, this knowledge helps you protect that response. If you've had biologics fail before, this gives you a framework to understand why and what might be different next time. And if you're about to start a biologic, you can go into it with your eyes wide open, knowing what to monitor, what to ask about, and what the future of combination therapy might mean for keeping you in remission longer. If this helped you understand why biologics sometimes stop working, share it with someone who needs it. Send it to someone who's cycling through medications and doesn't know why. If you want more support around optimizing your biologic response and building the naturopathic foundation underneath your medical treatment, that's exactly what we do in the Crohn's Method community. I'll see you in the next video, and have a beautiful day.